Regenerative orthobiologics, what is it? It is the process of any regeneration of cells in your body using either your own cells or cells that are just like your cells. So what that actually means in practice is that we can harvest your own stem cells, your own growth factors. We have thousands of growth factors in our body floating around, ready to be used, because we're constantly hurting ourselves. We're constantly bumping our elbows, falling down, getting hurt, getting injured. And this happens all the time. Even if we don't have an actual injury, our bodies get damaged, get worn down. So growth factors floating around in our blood, they basically say, grow new tissue, grow new blood vessels, calm down inflammation, attract stem cells. These growth factors tell your immune system exactly what to do. The problem is, oftentimes, our immune systems are bombarded with too much to do. Heal this, calm that down, inflamed there. Eventually, what your body does is ignore it. That's when an acute injury becomes chronic. Your body stops responding, stops listening, stops healing, and you're now just caught in pain. Oftentimes we think, well, if I just wait it out, it'll go away. Sometimes that doesn't always work. Sometimes we don't just get out of pain by waiting it out. But our bodies are really good at healing. It's just too much information. So what regenerative orthobiologics does is use your own body's signaling in a very controlled and potent way to direct traffic, to tell your body there is a tear here, there is weakened cartilage, there is inflammation, and you need to prioritize this injury. Let's take a rotator cuff tear, for instance. The supraspinatus is the most commonly torn rotator cuff, and it's often injured without us really knowing about it. It's an old injury that can turn into a chronic injury, and then something small might inflame it. Now we can't move our shoulder. It's really painful to move our shoulder. Oftentimes the subscap, the infraspinatus, and the bicipital tendon are often involved. They're not working appropriately because your supraspinatus is half torn. So other tendons have to come in and help. Other muscles that weren't meant to lift your shoulder a certain way have to help. Now we're compounding. Now we're having tears in not just one rotator cuff, in two, in three. Now we have swollen, inflammatory joint. Now we have a tear in the labrum. They tend to compound on each other. What regenerative orthobiologics can offer is to stop that inflammatory, painful process and then direct the body to heal the actual injury. Because what you're feeling might not be from the actual tear anymore. Your body's trying to clear fluid. Your body's trying to heal the labrum. Your body's inflamed bursa is now irritating you every single time you move your shoulder. So concentrating your own body's growth factors and then specifically injecting into that tear, because we want to heal that tear as the original injury to your whole painful process, then directs traffic. Now your body can heal exactly the root of your pain, which would be the tear. The next thing would be the functionality once that's healed. But it first starts with addressing the root cause. And that often comes with the initial injury, an old injury that's turned chronic. The types of orthobiologic solutions varies greatly. There can be solutions that are derived directly from your body. That would be things like your own blood or your own stem cells. We can draw growth factors by concentrating your platelets. This is called PRP. In your own blood, there's a couple different layers. There's your red blood cells, there's your platelet-rich plasma, and then there's your platelet-poor plasma. That platelet-poor plasma is what we're often testing for labs. Hormones, virus markers, electrolytes, liver enzymes, lipids, we're often testing that portion. But the portion between the platelet-poor and the red blood cells is PRP, meaning platelet-rich plasma. Platelet-rich plasma holds all of our growth factors. And the research has shown if we can concentrate those platelet-rich plasmas at a certain level of billion cells, we can expect a certain outcome in your healing. The research has shown 80% of people get 80% of better in 8 months. That's what we can expect with one injection that's appropriately concentrated. Now, that's platelet-rich plasma. There are other orthobiologics such as adipose-derived stem cells and bone marrow-derived stem cells. They both work the same way though. We are directing your body to heal a certain injury. The difference between PRP, your adipose stem cells, and your bone marrow is that PRP is the signal. PRP, we're just signaling for your recruitment of stem cells to then translate into new healthy tendon, new healthy cartilage. Adipose-derived stem cells and bone marrow-derived stem cells are the actual stem cells. There's no recruitment necessary. We're transposing stem cells from those locations, because even if you're 50 years old, you still have stem cells. We're transposing stem cells from those locations and putting it directly into the area that needs healing. There aren't actual tendons there. We actually need to create new tendons. So we're transposing stem cells into the tear, and those stem cells can be any cell that we want in our body. That's why they're so powerful. They can be a heart cell, they can be a brain cell, they can be a tendon cell. And that's what we're doing when we're directing stem cells directly into a tear. We're telling that stem cells, you're no longer just floating around in the bone marrow. I need you to become a tendon. And that's what happens. One is not better than the other. It's using your body's ability to heal any which way. And oftentimes it comes down to resources, how healthy you are, how much prep we can do prior to injecting you to get the best outcome. So we often take those things into consideration when we're determining what's the best solution for you. Is your body the healthiest version it can be? I often tell my patients, you are my pharmacy. So everything I'm extracting from you needs to be the healthiest version. If I'm taking out your blood or stem cells and we're telling your body to heal, you need to be in the best peak of health in order to get the best outcome, because that's obviously what we want. So in doing that, that's where I bring in a holistic approach to regenerative medicine. We need to make sure to do the work before we inject you in order to make sure you're not inflamed, that your hormones are balanced, that you can sleep, so that you get the best healing possible.